In this video, I want to talk about Sever's disease. I want to talk about what Sever's disease actually is, what causes it. I want to let you know the 4 things you need to think about in order to get rid of Sever's disease. And then at the end of the video, I'm going to talk about some extra tips that you can think about so that you know perhaps when to get your child or loved one back into sport and exercise, and some things that might help them in that journey when they do come back. So let's dive straight in. If you're not familiar with me and you're new to our channel, my name's John. I'm a sports injury therapist. I've been working with Sever's disease as a condition and adolescent young athletes for nearly 2 decades now, and Sever's disease is one of the most frustrating conditions. I hate to see how much it can affect children. It's really hard because it tends to affect children quite young, so typically between about the ages of 8 to 12. It can even be younger than that. So seeing young ones in pain and not able to do the things that they love really hurts. But what I want to do is explain what it actually is, and because that's what you need to understand if you're going to get them free from this injury and back into the sport and exercise. So what Sever's disease is, well, what it's characterised by is a pain at the back of the heel. So you might have seen your child and loved one avoiding putting their heels down. You might see them almost walking on their tiptoes or complaining of pain that increases as they go through running, jumping based activities. So we see it a lot in running sports, so your runnings, your footballs and things, but in things like gymnastics or trampolining, when you might be doing lots of impact on the area and that you're not perhaps wearing supportive footwear because it's not accustomed to your sport. So what's causing it though? Because that's where we're getting the pain. That's what I call the effect. But the key is understanding the cause. And really the cause is the calf complex. Now, what is the calf complex? Well, that's the 2 muscles living in the back of our leg, putting it quite simply. But we have 2 main muscles in the back of our leg that come down and attach right onto that heel, the point where we're getting pain, via what we call our Achilles tendon. So let me break that down to be a little bit more simple. In the back of the leg, we've got 2 muscles called our gastrocnemius and our soleus. They join an Achilles tendon which attaches into the back of a heel. Now the problem for a young athlete is that area at the back of the heel is what we call a growth plate. It's not bone yet on the growing child. It stays a soft structure called cartilage which grows until our feet are fully developed, so it allows our feet to get bigger and then it turns to bone. Now the problem is if we're using those calves a lot, so running and jumping and springing and things, it's pulling on that soft structure, that soft area at the back of the heel, which causes a lot of pain. So as I said, typically children might not have it all the time, but as they start running and pulling away at that area or jumping and land on that area, it starts to become sore. So if they're sore at the end of a training session in the heel and they start walking on their tiptoes, that might be typical. It may have got to a point where the pain's there all the time. Unfortunately, once it's there, it's there to stay in terms of that session. So I hear people say, we'll just run through it or train through it. Not the right advice. It won't go away at that point if we just train through it. We're just going to pull more at that area at the back of the heel, which will make it more painful. I also hear people say, well, it's a growing pain. You just have to leave it. Just keep going through. Bad advice, because we're going to carry on pulling at that heel, make it more painful. Or people say you just need to stop. You need to stop doing everything, sit down, put your feet up and let it all settle down. Well, again, this isn't necessarily the right advice. It might help in its infancy, but as soon as you come back into that sport and exercise, you're going to start pulling at that heel and you're going to get the pain. What we need to do is actually get at the cause. And as I mentioned, the cause are these calf muscles. So although the pain is at the heel, we don't need to think about the heel. We actually need to think about the back of the leg. The way I describe it to the children I see in clinic is, imagine we've got a child being bullied in the playground. The child being bullied is your heel. Now, what we can do is we can take the child out of the playground. We can stop you doing sport and exercise. But what's going to happen when we put that child back into the playground? And the patient would say to me, well, they're going to carry on getting bullied. Exactly. So that's not going to solve our problem. It will help in the short term. If we take the child out of the playground, that's good for them. But we know we ultimately need to put them back in the playground. The problem's going to come back. So when I ask the patient, what do we actually need to do? They need to say, we need to correct the bullies. And that's exactly the right way of thinking of this injury. We need to do 4 key things to that calf area, really, or 4 things we need to think about in order to actually correct that so it stops pulling excessively on that heel. So the first thing we need to do, We need to settle the symptoms. We don't want your child or loved one to be in pain. That's not going to help. So we need to settle the symptoms. Well, how can we do this? Well, yes, there's an element of rest involved. So if it's hurting when they're competing or training, then we need to take them out of that for a period of time to just let that symptom settle to the point where they can walk around comfortably and not feel that pain. During this period, things like ice can be helpful. Ice in the heel for about 10 minutes. So because the calf has pulled away and caused inflammation, we want to calm that inflammation down. So things like ice can be really helpful. It can be helpful to put things in their shoes, something like heel raises or added cushioning into their shoes. So when they're walking around, if they're having to go to school and things are walking around, we're giving a little bit more support to that area so it's not quite so painful for them. But that's the first tip. But what we actually need to do is, as quick as we can, get on to our next tips, which is firstly, we want to make the area more flexible. So what we might tend to find is that the areas become very tight. They're a young child. They've not been doing lots of stretching and things. Of course they haven't. But what they've done is started to use those muscles a lot. So the muscles have become tight. So what we can do is look to stretch out those muscles. And there's two key stretches, a stretch for the gastrocnemius and a stretch for the soleus muscle, the two muscles that I mentioned earlier. So here you'll see the stretches. So for the gastrocnemius stretch, what we want to do, and we can lean against a wall, that could be helpful, but we don't have to. What's important is we have those feet spaced apart and all toes pointing forwards. You'll probably find that your child will look to turn their foot off at the back angle to offset it. It needs to stay nice and straight. And the key thing here is that the heels need to remain super glued to the floor. I always say to patients, imagine your heels are super glued to the floor. And then what we do is we bend that front leg and keep the back leg straight. And they should feel the pull in the back of the lower leg. Now, as I mentioned, there's two muscles though that are pulling on that Achilles tendon or using that Achilles tendon. So we need to get the other one, and the other one is the soleus. It's a similar stretch, but you'll notice the feet are a little bit closer together. And the big difference here is that we're bending both legs. So rather than keeping the back leg straight, we're bending both of those legs. Again, two key points to follow. All toes pointing in a nice straight line and heels being super glued to that floor, because that's going to be really, really helpful. You want to be holding these stretches for 30 seconds, and your child can be doing these 2 to 3 times a day. We can do these nice and regularly. We don't want to bring on pain. Don't make them stretch so far as it causes pain, but just stretch to the point where they start to feel those fibers pull without pulling at that heel. And over time, you'll start to see their range of motion increase. Now, the next thing that we can look to do, or what we want to do, is to improve the tissue quality. Now, how can we do that? Well, this is where things like massage or rolling come into play. So there's a variety of devices you can use. I would always recommend you seeing a medical practitioner, getting massage into that area, that calf and soleus. Someone who's worked with Sever's disease before, they will be knowing the areas that need to be hit. But that whole lower leg, we want to massage through. But you can do this at home. You can use things like a massage gun to work into the area. You can use things like a trigger ball, or a hockey ball, a cross ball, cricket ball to roll into that area. So you lay down onto that, same as you would do a foam roller. Now, my difference here to the stretching is I wouldn't do this every day. I'd spend about 5 minutes doing this every other day. So what we're looking to do here is start to work into that tight tissue, but then we want it all to heal up. So by having that day off in between, we're just allowing that healing process to happen. Then we can get back on and carry on trying to overall improve that tissue quality. The fourth thing we want to do is we want to build the strength in the area. We want to make those calves nice and strong. So hopefully with the last 2 tips, we've made it good tissue quality. We've made it nice and flexible tissue. Now to return to sport, what we want to do is make them nice and strong. Now, firstly, it's going to be quite sore. We can do this in a non-weight bearing sense. We can have the child laying on the floor and simply pointing their toes up to the shin and then down towards the floor. So looking to just start to pull up, pull down. And again, I call these ankle pumps sometimes, but we can look to do this 3 times with about 12 repetitions. So 3 sets of 12, just looking to hold that muscle contraction for a few seconds. So when the toes are up, we're holding it for 3 seconds and then down for 3 seconds. So in its early stages, this is a little bit like what we might call isometric contractions, and they should be a little bit easier. As your child gets to be more pain-free, what you can do is test them out on calf raises. And again, what we can look to do is do a calf raise where they're using 2 legs, going up onto their tiptoes and holding that position. Okay, shouldn't be pain, but if they can get up and hold and then relax down, that's going to start strengthening them up. Again, it might be that you just hold for about 10 seconds if pain allows, doing that 3 times. Then we can change those calf raises to be what we would call concentric calf raises, where we're just going up and down. And again, looking to do 12 repetitions 3 times. If we're getting to the point now where they're doing that and they're pain-free and you've been stretching, improving the tissue quality, we're onto a good thing. They're calf raising, that's looking good. We can make that harder by doing a one-legged calf raise. So by simply hooking the leg behind the other leg, coming up and doing the same thing, except now doing 6 repetitions on each side. So 6 on the left, 6 on the right, and we can do 3 sets of those. So now that we've got to the point where we've improved the tissue quality, we've improved the flexibility, we've improved the strength, and hopefully we've settled all the symptoms with the ice and rest. So the big question here is, how do we know when they can get back into sport? Well, the problem here is there is no set, hard and fast answer. We have people come into the clinic who pop back within a week, follow-up appointment 1 week later, and they're doing great, and others who can be plagued for a little bit longer. There's so many variable factors. How far had the Sever's disease set in before we got these interventions? But ultimately, even if you get to these things quickly, what we're dealing with nature, and it's really related to things like growth spurts. So you might have noticed that your child's feet have grown recently and they're going through that growth spurt, so the growth plate's open and that makes it more susceptible to damage. So there's so many variable factors. So really what we want to be doing here is listening to pain. So what I would tend to say to somebody, and because this is an overuse condition, we want to limit the amount of sport and exercise we're doing as we return. I almost think of it as like helping a food allergy. We strip it all out and then we drop the foods back in slowly to see what the body can tolerate. So at first, for perhaps a small period of time, we'd take them out, sport and exercise. And then if they were doing 3 or 4 sessions a week, we maybe drop them back into 1 session. How did that session go? Were they fully pain-free? If they were, then we can start to maybe slowly increase and go back to 2 sessions, come out and so forth, till they slowly build back to that pre-injury rehab. So if they were doing 4 or 5 sessions before that, we don't just go, right, we've rested for a period, we go back into 4 and 5. That's gonna be too much for the body to cope and we'll be back to square one. Slowly drop those sessions back in as they make their way back to pre-injury levels. Other things to think about, as I mentioned earlier, in terms of little tips, are things like heel raises can be helpful. So those gel cushions that I mentioned earlier. So again, once they are returning to sport and exercise, if they're wearing shoes or boots, whatever they might be wearing, they can be really helpful to put in. If they're not, if they're in sports like gymnastics or trampoline or dance and they've been suffering and they can't just put heel raises into their shoes, then what I would suggest is in that other shoe. So when they're walking around at school, at home or out and about, use those heel raises to not be putting any extra pressure. If pain still persists, keep the ice going while you keep working the other 3 tips that we spoke about earlier, and hopefully that will help guide you on their way back. It's a really tricky condition. I find it one of the most frustrating because it's often someone's first injury, and trying to tell a small younger child that they can't do the things they love is really painful. But you can get over it. It needs to be slow and progressive and being sensibly. Don't do the 2 things that, in my opinion, are the complete wrong things to do, which is just sit and rest and dive straight back in when you think it's going to be better. Or even worse, probably, is just force your child to work through the pain. Strip them out and slowly integrate them back into their sport and exercise, following the tips that I've mentioned in this video. I hope that this video has been helpful for you. I really hope it gives you something to think about in terms of helping your child or loved one back from Sever's disease. I know at times it feels like it's something they may never get over. They absolutely will. It's a super common condition, unfortunately, and something that is part of the growing adolescent life, but they will overcome it. Follow these tips, and any questions, drop me a comment below and I'll make sure that I come back to those. I try and answer every single comment that we get. And if you find this information helpful, and you know what? It's been quite a long video by now. Thank you for staying with me. If you're still here, smash that like button, because that's showing me that this is the type of content that people want to be seeing. So I'll make more videos like this. And also, if you haven't joined our community, why not hit that subscribe button so I can see you on the next video.